Chelsea.
Hi.
Hi, I'm Jordan. I'm going to be the nurse with you today.
Okay.
We're just going to go through a quick health history before we ask you a bunch of questions.
Okay.
Could you tell me your date of birth?
June 15th, 1989.
Okay. And what brings you in today?
I've had back pain for about 2 years or so.
Okay. How did that start?
I believe it was from a running injury. I used to be a big runner. I ran a half marathon about a year and a half ago.
Good for you.
Or about 2 years ago. I kind of felt like this zinger go down my leg when I was running, and then a couple weeks after that I started with like more pain in my leg and my back, so I don't know if that's what caused it. Or
what sort of techniques or treatments have you utilized prior to coming here for your back pain?
I tried, steroid dose packs, and I've tried physical therapy, and I just don't feel like it's just been enough. Like, steroids wear off, and then, PT, you can only do so much.
Right.
You stretch, and then it kind of goes back to where it is.
Okay. So just a little bit about your health history. What medications are you allergic to?
Protonics.
Okay. What happens with protonics?
Causes my mouth to swell.
Okay. Any illnesses as a child?
Just chicken pox.
Okay. And how about your family? Your parents, your grandparents, your siblings? Any major health concerns with them?
My mom has rheumatoid arthritis. Other than that, my grandfather, who's deceased, had a very large cardiac history and diabetes.
Okay.
But everybody else, my father's living, my siblings are living.
Okay, great. Any other major surgeries or procedures in your history?
I had right knee surgery, and then I had my appendix out.
Okay. How do you feel like your back pain impacts your kind of quality of life?
I just feel like I can't do the things I want to do. Like, especially at work, I feel like, sitting too long hurts, standing too long hurts. I feel like, I'm always sitting or standing, getting up and down. Where I work at, I have to push like a cart, that hurts sometimes if I have to push that around. Or, turning a patient, that hurts.
Okay. What prescription medications do you take on a daily basis?
I take Dexalent for my reflux, and I take Zoloft for anxiety, and I take an iron supplement.
Any other over-the-counter medications?
Vitamin D and maybe just some ibuprofen if I need to.
Okay, perfect. Any problems with your heart that you know of? Any history of stroke, heart attack, irregular heartbeats, or rhythms?
I had a murmur as a baby, but other than that, nothing.
Okay. Any problems with your lungs or breathing? Asthma, sleep apnea?
I get like allergy-induced asthma.
Okay. Any history of seizures, fainting?
No.
Okay. Any problems with your hearing or vision? Do you wear glasses or contacts?
Contacts and glasses.
Okay. No problems with your hearing?
Nope.
Alrighty. And so you take some medication for your reflux.
Mm-hmm.
Any other problem with your heartburn, bowel habits, abdominal pain?
No.
Okay. And let's see. Any other joint pain, osteoporosis, other problems with moving about other than your back pain? Okay. Any history of diabetes, thyroid problems?
Nope.
Okay, perfect. Okay, so a little bit about your kind of daily life. So what does your diet consist of? What do your daily meals usually entail?
I'm not a big breakfast eater, but like for lunch and dinner I try to eat like meat and vegetables.
Okay.
I try not to snack as much as I can.
Okay. Do you feel like you have a pretty well balanced diet and you're usually able to kind of include all of that? What do you do to be active?
I try to go to the gym if I can, depending on how my back feels. If not, then I just try to take the dog for a walk if I can. Just, walk around the block, get her out, get her active too.
Okay, perfect. How many hours of sleep do you typically get in a night?
Probably 5.
Okay. How would you describe the quality of your sleep?
I feel like I sleep, but I don't feel like I get enough, like a good enough sleep at night.
Okay.
Especially with the back pain, I feel like constantly having to move around to get comfortable.
Okay. What do you think are some things you could do to get a better night's sleep? Any certain positionings or pillows or?
So I try to, if I can, sleep on my stomach. That's usually the spot that usually it doesn't make my leg hurt as bad. Sometimes elevating my leg with a pillow will sometimes do that.
Okay.
Even sleeping in a recliner sometimes.
How can you kind of tell the following day that you have or have not gotten a good night's sleep?
Getting out of bed is awful in the morning.
Okay.
I just kind of hit the alarm over and over, and then I just feel tired and I just can't focus at work.
Okay. So what do you do for work?
I'm a nurse.
Very nice. How long have you been a nurse?
About 9 years.
Good for you. What's your highest level of education with nursing?
I have a bachelor's.
Okay. How do you think education is important, especially when it comes to your career?
Well, I feel like the higher education you have, the more advanced you can proceed into higher positions. A master's, you can be a school nurse or a teacher, or even a nurse practitioner. And then you think of management, somewhere big, a hospital, being a director of a certain department and stuff like that, or a nurse manager.
You definitely have a lot of opportunities.
Yes.
When it comes to nursing.
Yes.
What do you like to do outside of work in terms of your friends, social interactions, hobbies?
I like to bake.
Oh.
I did culinary arts in high school, so I like to bake. I like to do makeup.
Okay.
And my friends and I will go out and do things go see shows and go listen to music. And
about how often do you go out with your friends?
Maybe 2 to 3 times a month.
Okay, great. How would you describe your caffeine or alcohol consumption?
Well, I drink probably 1 to 2 cups of coffee a day.
Okay.
Alcohol consumption, just socially, usually when I just go out with my friends.
Okay, perfect. And what are some sort of cultural or spiritual values, aspects, medical concerns that are important to you?
So my faith is a big thing for me and my family. Prayer. So our church has a prayer group.
Okay.
So you can express your concerns to them and they pray for you. And then every couple weeks they send you a card in the mail and they're like, "Hi, we're praying for you. If you need anything, please reach out to us."
That's really nice.
Yeah, so it's been great.
What religion do you associate with?
I'm a Methodist.
Okay. So it sounds like your church and your faith are a big part of your support system.
Yes.
That's great. Who's at home with you?
Just my husband and dog.
Okay. And do you have any other family members that live close by?
My parents live maybe 10 minutes away. My brother lives with my parents, and then my other brother lives about 2 hours away.
Okay. So what does it mean to you to be kind of financially or economically stable? Do you own your own home and kind of...
Yeah, we own our own home. We own our own vehicles. I mean, just not having to worry, not having to live paycheck by paycheck and worrying am I going to be able to afford this or afford that?
Okay.
Just being able to live life without having to worry.
Great. Do you have any financial limitations or concerns when it comes to your medical care?
No.
Okay. And what does it mean to you to feel safe at home?
Coming home, not having to worry, am I going to say the wrong thing or am I going to upset somebody or, not, being afraid.
Okay.
You come home and you just want to be like, hey, I'm home and relax and just not have to worry about anything when you get home.
How about feeling safe or comfortable at work?
Not having to worry about any harassment issues.
Yeah. I'd say that's not too much to ask for.
No, I mean, being able to come into an environment where, your coworkers are great and you don't have to worry about, especially where I work at, the patients, they're great. They don't, they get to know you and...
Okay, sounds great. And so you feel like you have a pretty good work and home balance?
Yes.
All right, great. So you feel safe at home with your husband and your dog?
Yes.
All right, perfect. Do you have any questions for us concerning your care today?
Nope.
Alrighty, I'll pass this along and we'll get you started, okay?
All right, thank
you.